Ontario's new plan for healthcare is getting mixed reaction from across the province, and it's no different here in Thunder Bay. The president of the regional hospital is hopeful about the possibility of growing the healthcare workforce, but the head of the local health coalition believes it's a move toward privatized care. Vasilios Bellows reports.
The Ontario government's healthcare plan was announced last week by Minister of Health Sylvia Jones, who called it a plan to stay open. It has a strong focus on hiring more in the sector. The PC say their goal is to bring in up to 6,000 healthcare workers. The plan also mentions emergency room relief for northern and rural Ontario by adding 400 physicians, though how Thunder Bay may be affected by that is still unclear. Hospital CEO Rhonda Crocker Ellicott is hopeful after the release of the plan and believes growing the sector's workforce is critical to pandemic recovery.
Reducing the surgical backlog. That's a significant issue. We have our surgical wait lists have increased by 27% through the pandemic. That's about 1,000 additional cases. But in order for us to do that, of course, we need to have a stable workforce in order to grow capacity to address patients' needs that have been unmet through the wait period.
The health plan also introduces new legislation that, if passed, will help move patients out of hospital and into long term care faster while they wait for their preferred home. The provincial government has said this is an important move, which will free up much needed hospital beds. Local Health Coalition co chair Jules Tupker opposes this legislation and says it moves patients unwillingly into privatized long term care homes, where death rates have been higher during the pandemic.
So people are now even more aware of the problems in private for-profit homes, and they don't want to go there. And that's what's creating the shortage or openings rather in these homes. And Doug Ford is making it so that they can force people out of the hospitals into these homes without their consent.
The health plan also includes a $300 million investment in 2022-23 as part of Ontario's surgical recovery strategy. The province is also considering options to increase surgical capacity by adding the number of OHIP cover procedures carried out at independent health facilities. Vasilios Bellows, TBT News.